Hello, I'm Dr. Gonzalez, and I'm trying to talk to you about how to take care of your implant placement site. So today we place an implant for you, or maybe more than one. I kind of walk you through what to do afterwards, but sometimes, we forget, we get a little nervous afterwards, so this is what this video is for. For the most part, we want you to stay away from the area where we place your implant, okay? It's important that you know that implants is really not something that is very delicate. So if you forget or anything of what I'm telling you and you eat on that side by mistake, nothing really is going to happen to your implant, okay? They're very nicely secured in the bone, so you don't want to knock them out or get it loose, okay? But we still want you to be careful with the area. So for the most part, we ask you to bite on a gauze when you leave the office. Change that gauze every 35, 45 minutes until you see that it's not really bleeding anymore. You're always going to see a bit of oozing on the area, okay? So the gauze is always going to look a little bit reddish, but it's not going to be soaked in blood, okay? So pressure with the gauze for 35 to 45 minutes. Change it a few times until you see that it's really just a little bit of oozing or really nothing is coming from the area. Try to eat on the opposite side. Make sure that your food is soft and room temperature. You don't have to just eat smoothies and soup. Okay? If you can eat some solids, we want you to eat well. It's important that you eat so you can heal. You're also taking some medication that I prescribed you. So it's important that you have some food, okay? Things that you can eat that are soft and room temperature are ideal. So let them cool down. Make sure that they're room temperature or cold. Ice cream is okay, but nothing hot, okay? At least for 5 days. Same with your coffee or your tea. Iced coffee or iced tea. Chew on the opposite side, soft things. Perhaps, for example, pasta with a little made and bean meat sauce. This is something that is soft and nutritious. Scrambled eggs, soft rice, soft chicken. Absolutely, you can eat. Just make sure that it's soft and you let it cool down. Take your medications, apply your ice pack in the area. Ice really helps the first 24 hours, okay? So that first 24 hours is when we want you to have ice. Normally we ask you like a 5 minutes on, 5 minutes off with the ice, but if you can just leave it there and you fall asleep, nothing's gonna happen, okay? Make sure that when you sleep tonight, when you go to bed tonight, try not to lay completely flat on your bed. Try to be sleeping maybe in a 45-degree semi-seated position so your head is a little bit elevated. That will also reduce any potential swelling. Take your medications as instructed, and just leave the area do its own thing. Sometimes I prescribe you a medicated rinse. I don't do it all the time. It depends on what we have to do for you. If I did prescribe you a medicated rinse, I want you to start using it the next day. Don't rinse today or tonight, okay? Just the next morning after you brush your teeth. Don't brush the area where your implant was placed. Stay away from the sutures and the stitches and all that. And then use that medicated rinse after you brush your teeth to kind of keep the area clean, okay? We want you to use the rinse for about 7 to 10 days, no more than that, okay? After that, you can stop it. You can start brushing on the area after the first 3-4 days. Just make sure that you do it carefully, maybe around the teeth that are around the area. Don't brush necessarily the stitches or the top of the gum. Of course, we're always here. So if you have questions, you need to talk to us, give us a call, okay? We're always available for you. But really that's what we want. Stay away from the area, soft food, room temperature, pressure with the gauze at the beginning, and apply some ice for the first 24 hours. I hope you're feeling great after that implant. See you soon.